Ladies and gentlemen, distinguished guests, my name is Charlie McConalogue and I'm the Minister for Agriculture, Food and the Marine. It's great to be able to speak with you all at the launch of Animal Health Awareness Week 2020, which will take place this week from tonight until Saturday the 28th of November. The Animal Health Awareness Week is delivered in accordance with the National Animal Health Surveillance Strategy 2016 to 2021 and the National Farmed Animal Health Strategy 2016 to 2021. This week builds on the success of the first ever National Animal Health Awareness event that took place in November 2019. Last year's event highlighted the importance of good livestock health for the viability of farming and the economy. It also reminded different stakeholders of the part they must play in maintaining and improving our country's animal health status. Initiatives such as Animal Health Awareness Week also underpin my department's and this government's commitment to ensuring the economic, social and environmental sustainability of rural farming. Unfortunately, I cannot be with you in person this evening, and I hope that we are nearing the point in the future where we can once more meet collectively. I welcome all of you who have joined tonight, farmers, vets, academics and a range of other very important stakeholders. You are vital to the success of Animal Health Awareness Week, and I know that many agri-sector organisations are lending support with your contributions. Irish farmers understand the importance of good animal health. Our farmers care so deeply and passionately about their animals, and I commend them for the high standards they continue to set themselves in terms of good animal husbandry and management skills and achieving good animal health outcomes. However, as with any profession, there is always room for improvement in relation to knowledge and awareness of animal health among farmers and others. For this reason, we intend to reinforce our animal health awareness messages this year, and we're seeking to bring them to a wider audience. To do this, we have increased the profile of the event on digital and social media. We are also making use of additional forms of communication, including online advertising, podcasts and local radio. I commend the many stakeholders in the agri-food industry who have worked in partnership with my department to deliver this Animal Health Awareness Week. Good animal health is inextricably linked with good animal welfare. Irish farmers deserve great credit for providing such good care for their animals, even with many demands on their time. Let me be very clear, however. Animal health has been under increasing scrutiny by the public in recent years. Our entire sector is under the microscope when it comes to maintaining our high standards of animal health and welfare. We cannot let our standards slip. As an industry, we have set ourselves high welfare standards, and these must be maintained and indeed improved in order to protect our social licence. Apart from the public interest element, our good animal health and animal welfare is a key selling point for agri-food products, domestically and internationally. The Farm Animal Welfare Advisory Council, calf welfare guidance to be launched this week, provides a way forward for all stakeholders to achieve better animal welfare outcomes together, but also underlines commitment to high animal welfare standards. Links between the public health and animal health are perhaps best understood through the One Health framework. This framework is based on the simple idea that human health, animal health and environmental health are all interconnected. Antimicrobial resistance is a serious concern for us. The link between human and animal health with regard to AMR is inextricably linked. Failure to effectively deal with AMR threatens to set back the advances of the last 80 years in human medicine. As a result, operations which we now consider to be routine could become too dangerous to perform. And infections now considered harmless thanks to antimicrobials could become a serious threat to life once again. AMR is first and foremost a human health issue at the moment, but it is also an issue for animal health. The more we use antibiotics in our livestock, the more likely it is AMR will develop and also spread to animal populations. As a result, many commonly used animal remedies could possibly become ineffective in the years ahead. And this is a real threat and a real concern. The most serious consequence is that the same antimicrobials that is in use in our animals also have an important role in human health. In order to protect human and animal health and reduce the rate at which AMR is developing, we need to reduce our overall use of antimicrobials, and improving animal health is a key step in that. AMR is one of the greatest challenges to face our generation. It is a challenge which we must overcome, and it is a challenge we can collectively overcome. Greater use of disease prevention programs in our herds and flocks and proactive herd health management allow us to achieve lower usage of antibiotics and other antimicrobials without negative impacts on the health of individual animals. I would urge all farmers to engage in proactive and preventive measures to protect your animals, and where disease does occur, to take steps to get to the root of it. Continuing on the public health theme, less than a year ago, few of us here were expecting the upheaval which COVID-19 would cause. The lesson for all of us is that we must expect the unexpected with infectious diseases. The social and economic effects of COVID are on a par with its direct health effects in many countries, including our own. Many diseases of animals carry a similar threat of large-scale social and economic disruption. Examples include foot and mouth disease in Europe in 2001, BSE from the 1980s onwards, and African swine fever in many countries in the past decade. We must be vigilant for these diseases and for others, and this is the primary reason for holding Animal Health Awareness Week. The COVID-19 pandemic has also highlighted the importance of a well-functioning supply chain for safe and nutritious food. Livestock are the source of many of the food products which sustain our population. The COVID experience underlines our messages around keeping livestock healthy. This week, we draw attention to what can be done to keep diseases outside the farm gate and to control or limit the effects of diseases which are present in our herds and flocks. The first ever National Farmed Animal Biosecurity Strategy will be launched on Wednesday the 25th of November. It sets out a way forward for those who work with livestock to protect the asset that is the health of our animals. I particularly encourage farmers, vets and others involved in livestock farming to engage with the communications which my department is producing during the Animal Health Awareness Week, and to apply the knowledge gained in their daily work on farms throughout Ireland. We all have a part to play in keeping Ireland's livestock healthy. Let's ensure we do that. Turning to tonight's programme, our focus is on the connection between animal health and human health. We will be hearing from our Chief Veterinary Officer, Martin Blake, on this subject. It is great to have such a notable and august attendee list at our event this evening. I want to note Professor Tracy McNamara from Western University, California, Professor Myra Connolly from NUI Galway, and Professor Dominic Mellor from Glasgow University. I would like to sincerely thank our guests for agreeing to share their perspectives and expertise with us. I now hand you back to Damien Barrett, your host for the evening, who is a vet in our department and who has been centrally involved in the Animal Health Awareness Week project. Finally, I wish you all a very successful week. I know there are many events planned, and I look forward to hearing and seeing more about it. Thank you.